share my screen and we're going to get started here. All right, thumbs up. Everyone can see my screen, correct? All right, so welcome to our back pain and sciatica masterclass. This is for people who are suffering from back pain and or sciatica, or if you've suffered from it in the past. So a lot of people are here tonight because they've had long-standing back pain. They've tried a lot of different things and they haven't been able to find a solution that really works. A lot of you are here because you're kind of at this point where you've been told you need surgery and you're thinking, do I really need it? Do I want it? Is there another option? Some of you are here because you've had surgery and it didn't work, the pain came back. And some of you are here because you just want to prevent back pain. Maybe you know someone who's had terrible back pain and you don't want to end up like that. So you want to learn tips and tricks to help prevent back pain because you want to stay active, healthy, and mobile. So if any of those kind of sound familiar, you're in the right place. And what I want to say is that a lot of you are going to get exactly what you need from tonight's class. It's a great class. It's going to be full of information. A lot of you are going to walk away. You are all going to walk away with some actual tips and items that you can start doing immediately when we stop this presentation. So some of you are going to be like, wow, this is great. It's exactly what I needed. But for some of you, you're going to think you might want more information. So stick around to the end. We're going to give you an opportunity to come in and we'll talk. We have a special offer for you guys that if you do want extra help or you think you might need extra help, we will have that option for you, as well as kind of some surprise options. So what are you going to learn today? So today we're going to talk about why back pain is such a big problem, what people think causes low back pain versus what really causes low back pain. We're going to talk a lot about MRIs and x-rays and why it confuses so many people and sometimes leads people down the wrong path. You're definitely going to learn about things that you can start doing now. And then if you want expert help or if you want to you'll find out if you need expert help. We're going to go over that as well. So just a little bit about us real quick and why on earth you should be listening to us or listening to me. So CJ Physical Therapy and Pilates, we're here right now in the office. We specialize in helping people age 40 and up be more active, healthy, and mobile so they can spend time doing the activities they love instead of sitting in the doctor's office. We really like to focus on empowering you through movement instead of things like pills, procedures, or surgery. So a lot of people like to come to work with us because they don't want to have all these things done to them. They really want to learn how to take care of back pain all on their own. How do we do that? A few different ways. We are back pain specialists. We like to use Pilates here, as you can tell by the name. And we kind of are known for helping people who failed regular physical therapy. A lot of people try regular PT and they think, oh, I've already tried it. It's not an option for me anymore. It doesn't work. We actually see a lot of those folks who've tried regular PT and then come here and had a lot of success. And then the biggest thing that we do is we really, our goal is to teach you to not need us at all. We want to teach you how to take care of your own back. All right, a little bit about me. Believe it or not, I've been a PT now for 20 years. I've been specializing in back pain for the last 10. I've been around for a while. I love what I do. I have a great team here of other back pain specialists as well. I love working with them. I love helping them with tough cases and things like that. So that's just a little bit about me. And just so you can kind of understand or give you a reason to maybe listen. I do know what I'm talking about. I've seen hundreds of people with back pain. I've helped a lot of people with back problems. My specialists have as well. So you're in good hands tonight. We do know a thing or two about this thing called back pain. So getting into it. So back pain is a big problem. It affects about 31 million Americans. It's the second most common reason to visit a doctor's office. The first reason is actually respiratory problems. 4 out of 5 people will suffer from a debilitating low back pain episode at some point in their lives. So we're talking like you throw out your back, you can't move, you're stuck, can't go to work. That's what I'm talking about. 4 out of 5 people will suffer from that. And then people aged 45 to 64 are reporting the highest rates of back pain. I know a lot of you, some of you are a little outside of that range, but a good amount of you here tonight are in that age range. So it makes sense. It's costly. Back pain affects about we spend about 50 billion a year on back pain treatment. There's about 291 million lost days of work due to back pain and neck pain in there as well. Neck and back pain go a lot together. I bet some of you on here do have neck pain as well. A lot of the tips you'll learn tonight can actually help you with your neck also. We 131.8 billion annual earnings lost due to a back or neck condition. So those poor people out of work are just losing money because they can't do the things they're supposed to do. And then still, 500,000 Americans a year go undergoing surgery for back pain. And a lot of times it doesn't work. I just recently wrote an article about that, about failed back surgery syndrome. There's a lot of people out there that get surgery, and the studies keep showing that either it doesn't help them at all, or the pain comes back, anywhere from 12 to 24 months later. And so many people are still undergoing surgery anyway, when it's really only about a 40 to 50% success rate. There's very specific reasons to undergo surgery, which we may or may not get into later, but you'll find out that a lot, we can really bring this number down if we do just a few simple things, which we're going to talk about. So what causes back pain? Well, there's a lot of things that are known to cause back pain, and I'm sure none of these terms sound unfamiliar to you guys. Someone mentioned at the beginning they're here because they have stenosis. People get bulging herniated discs. Is it poor posture? Is it degenerative changes? Is it stress? Is it all of the above? There's a lot of different things that can cause it. So I'm actually going to bring Dr. Dakota in next. He's one of our back pain specialists. And what he's going to do is give you just a little bit of an overview of just back pain anatomy to help you to kind of understand what some of these terms mean. And when you hear them, like what exactly is going on in your body.
All right, so this first slide displays our spinal column. So this is the bony anatomy that's going on in the back there. So Dr. Carey might help me out and just move her mouse cursor around to highlight the areas that I'm talking about. But on the far left here, we have the whole spinal column. So the top portion is the cervical vertebra up at the top, and you can see there's natural curves that exist there. As it transitions down into the thoracic spine or your upper back, the curve reverses and it goes back the other direction before it finally curves again back in that first direction when we're down in the lumbar spine. The little hooked piece you see at the end is the sacrum combined with the coccyx, commonly known as the tailbone area. Over on the right-hand side, that's a zoomed in version of that side profile that we started with over on the far left. So in the front, you see the big chunky rectangular portion of the vertebra. That's our vertebral body. In between each one of those, you have discs. So I'm sure you've all heard discs, bulging discs, herniated discs. We're going to talk about all that later on in the presentation. But these curves that I mentioned initially can be affected. They're important for things like shock absorption and supporting us through daily life, but things like prolonged postures and sitting for long periods of time can affect those curves. So Dr. Carey is going to talk about that a little bit later. Okay, so sciatica, what causes it? So over on the left, again, we have a side view. It's just a different illustration of the previous slide. In between each of those vertebral bodies and the spinous processes that are coming off the back portion of the vertebra, you have these little holes, or they're known as foramen. Exiting those little holes are the spinal nerve roots that come off of our spinal cord. Irritation to those spinal nerve roots that feed into the lower leg is actually what causes sciatic symptoms. And typically the thing that's putting pressure on those nerve roots is a disc. So as you come over to the right-hand side here, you see what a healthy normal disc looks like up in the top left-hand corner. And then you can see what it starts to look like as that disc starts to bulge, or in some cases herniate out of that outer ring that kind of holds it all together. Okay, and then some of you, as you mentioned in the chat earlier, are here because you have stenosis. So arthritis and stenosis, those are terms that are used a lot when we're examining backs. So over on the left-hand side, we have an illustration of what disc thinning can start to look like, or herniated and bulging discs. And then when that disc wears out, you get some of this bony abnormality that occurs where those bones down at the bottom there start to look jagged or different. Those abnormalities are sometimes called osteophytes. They're just changes in that bony appearance that we see on imaging. Over on the right-hand side is stenosis. So you can see in the middle there, the healthy spinal canal is nice and open. It's free. There's a lot of space in there for the spinal cord to run through. And then on the right-hand side, it starts to narrow a little bit. So you get some of those bony changes that press on the spinal cord and can cause some of that pain or numbness and tingling down the legs and into the feet. Overall of that, so overall of the structures that we just spoke about are the muscles and the ligaments. So those kind of provide support to those structures that we just mentioned. So over on the right-hand side, it shows some of the intricate ligamentous or ligament structure that connects bone to bone through each vertebra in your spine. So that's our first supporting layer. Close to the spine, we have a deep layer of muscles, very small muscles that kind of stabilize and help us move throughout the day and keep things stable in that spinal column. And then above that deep layer, we have the superficial muscles, which are like the ones you can see in the mirror or see beneath the skin that everybody thinks about, the big lat muscles or the glute muscles that surround these areas. Those are our big movers. Okay, so out of all those things that we just mentioned, all those different intricate structures that exist in the spine there, how do we go about determining the cause of which structure is causing our pain, or is it even one of those structures to begin with? So Dr. Carey is going to talk more about that for you.
Yeah, so that's the big question we get all the time, we hear all the time is, okay, what is the thing causing my back pain? And one of the most common ways we tend to figure that out is, naturally you've got back pain, especially if it's debilitating. A lot of times the first thing you do is you go to the doctor. And then if it's pretty bad, especially if you got that sciatica that Dr. Dakota was talking about running down your leg, they will recommend you get an MRI to take a look inside and see what's going on. But MRIs aren't perfect. Well, actually, they're a little too perfect sometimes. So what happens with an MRI is that it shows everything. Okay, it's going to show you bulging discs. It's going to show you, stenosis. It's going to show you everything. But if you notice here, okay, what happens is all these things, these disc degeneration, signal loss, and height loss is kind of, your disc getting thinner, disc bulges, disc protrusion. It's not on here, but arthritis is another common one. You can see from this study, and it's common knowledge at this point that, this is very normal to see in your MRI, whether or not you have pain. So this shows the percentage of people that have these abnormal findings that are asymptomatic. That means they don't have any symptoms. So that means, if I walk in and I get an MRI of my spine and I have no problem, and then someone else next to me who has terrible back pain walks in and gets an MRI, our MRIs could actually look exactly the same, but I have no pain and this person has terrible pain. Why is that? Well, we're going to talk about that a little bit, but you can see why it would be confusing. And most importantly, why you shouldn't let your MRI decide how to treat yourself, because why would I want to, if I have a bulging disc and I have no pain, it makes no sense to cut that out. Why would the other person? So 60 to 70% of adults without any back pain have these abnormalities such as arthritis and bulging discs. I would dare say, are they really abnormal? Because really they occur normally as you age. The older you get, the greater your chances are that a back x-ray or MRI is going to show these things, even if you have no symptoms. That's going to be really important that you remember tonight. This leads to inaccurate associations between the findings in your images and the pain symptoms you're experiencing. So what that means is, you have pain, you go in, you get your imaging, and they say, oh, bulging disc, that's the reason you have pain. Or, oh, you've got degeneration in your spine, that's the reason you have your pain. Well, we don't really know that, because you could have had that all along. Why now is the pain happening? And ultimately, by letting your diagnosis be determined this way, it does end up leading to unnecessary procedures and surgery. It's why we have that failed back surgery syndrome. It's why so many people get injections, they get surgery, and they don't get relief. They might get temporary relief, but the pain comes back. And every time you undergo one of those procedures, it makes it harder for you to get better naturally, which is what we're going to be talking about. And you don't want to go there if you don't have to. So you want to always make sure you're getting all the information, which is a big reason why we're here tonight talking to you. We want you to have all the information that you need, so ultimately you can make the best decisions for your health, not an MRI or somebody else. So, okay, what really causes back pain then? If it's not the disc, it's not the this, it's not the that, what the heck is causing this pain? Why do all these people say that it's these structures that cause it? Well, here are some facts about low back pain. So What the research also shows is that 70 to 80% of all back pain is what we call mechanical in nature. So I'll talk definitely more about that in a minute, but mechanical back pain, the biggest thing to know is that if you're in that 70 to 80%, which the odds are pretty good, 4 out of 5 of you on here tonight, if you've got back pain, it's the odds are that it's mechanical. It can be treated naturally. That means no pills, no procedures, no surgery. So you really want to make sure if that's what you have and if you're in that category before you start going down the route of one of these things. The tricky thing about mechanical back pain is it happens slowly over time. That also causes a lot of confusion. It's often caused by just life, right? Poor postural habits, poor lifestyle habits, things that people just aren't aware of. But after tonight, you'll be aware of them. But that's what causes a mechanical back pain. It doesn't just happen. It happens slowly over time. And it's not diagnosed with imaging. You don't take an x-ray and say, oh, you've got mechanical back pain. It's actually diagnosed with movement. So common signs of mechanical back pain. And as I go through this list, think to yourself, is this what your back pain kind of feels like? Your pain comes and goes. You have good days and bad days. Your pain changes or moves around. For example, you might sit and it feels great, but then you go to stand up and it kills you. And then you start walking a little bit and it gets better again. But every day that pattern repeats itself, right? Or you sit and it gets worse and then all of a sudden your pain goes down your leg. These are pretty common signs of mechanical back pain. Your pain may have appeared out of nowhere. It's like, what the heck caused it? Maybe you've had surgery, you've had injections, it didn't work. And then a lot of times movement and exercise will make you feel better. One of the things I like to say to people all the time is, let's take arthritis, for example. When you have arthritis in your spine, like Dr. Dakota showed on that image, you get bony formations. Now remember, it happens normally as you age, but it doesn't change. It doesn't come and go, right? You don't have good arthritis days and bad arthritis days. I mean, yes, things like when it's true arthritis, you can have weather and things like that can affect it, but once you get those bony formations, it stays there. So it's not just the arthritis that causes this back pain. If your pain is coming and going, that means there's something else involved. And that's the mechanical piece typically that is so often missed. And when it's not addressed, you get surgery to like clean out the arthritis, let's say, or you get surgery to cut out the disc. Well, if movement caused that thing to get irritated, movement's going to cause it to get irritated again, or something else to get irritated. And this is the big reason why so many people fail surgery and injections, and the pain comes back, and then they get frustrated and they feel like they're at their wit's end and there's nothing they can do. If you nip this in the bud first, then you can get a much better treatment and not deal with some of these side effects. So what is mechanical back pain? The definition, now you're going to really think I'm crazy because the definition, it arises intrinsically from the spine, the intervertebral disc, and the surrounding soft tissue. So wait a minute, I just said that isn't the real cause, but what happens is these structures, the spine, like your vertebrae, the discs, and the surrounding soft tissues will get irritated. Those are the things that give you the pain, but a lot of times movement habits, everyday things are what causes these structures to get irritated. And that's the big distinction we want to really have you take home tonight, because that is the root. That's why people can go in and they can have an MRI with a bulging disc and not have any problems, and someone else doesn't. That person with no symptoms probably just has better movement habits, or maybe they have better posture, or maybe they just don't move in a way throughout the day that irritates that disc, which I'm going to explain that a little bit more in a few minutes. So if you're confused, I don't blame you. The whole world's confused. That is why so many people suffer from back pain. That's why I love doing these presentations and these classes, because it really does help kind of clear the noise for a lot of you, and light bulbs always start to go off whenever I do these. So what does contribute to low back pain? So I already started to allude to it. So it's life. I hate to tell you, posture, your lifestyle, maybe imbalances in your body, if you sit too much, if poor mobility, or just poor movement habits. When things get uneven, things get angry, right? And that's kind of the general rule. So we're going to talk a little bit about that. So lifestyle, imbalanced movement. What do we do all the time? We bend. Like half of the things we do every day involve this bending. So if you bend too much, the average person bends 3,000 to 5,000 times per day. you're going to start to get the structures angry. So with the disc in particularly, most back pain does involve the disc in some way. They do know that, but the disc, this healthy disc right here, is minding its own business. It's just fine. If you look at that healthy disc and kind of imagine it's like a jelly donut, what happens is when you bend forward, okay, it's like squeezing the jelly from the front. So if I squeeze the jelly, I squeeze the donut right here. Okay, actually, let's pretend this is the front. I squeeze the jelly from here, that disc liquid, this is kind of the nucleus, it moves around, this moves. Now, if you go the opposite way and you bend backwards and I squeeze from here, it's gonna go back in here. Now, what happens to so many people, if the average person bends 3,000 to 5,000 times a day, imagine what someone who drives a truck for a living or sits at a computer all day or has to like literally move boxes for a living, they're on the higher end of that spectrum. Remember I said that mechanical back pain happens slowly over time. Well, you keep bending, you keep bending, you keep bending. Eventually that disc kind of starts to hang out here, and then this is kind of what a bulge looks like. And these areas around the disc start to get weak from the pressure all the time. So it's not that the disc doesn't just spontaneously do that. That is why people get bulgy discs kind of as we age, because this is just what our lifestyles lead to. So poor posture and inactivity is a big problem. The other thing that can happen, so the discs is one thing, that is the more common thing that happens. But another thing that will happen is, if you remember, Dr. Dakota showed you all those muscles in the back of your spine. If you sit and you slouch all the time, you literally can overstretch those muscles. We get this phenomenon called creep. So what happens is the muscles just stretch and stretch and stretch, and they actually lose elasticity and strength over time. So that is also why it's important to vary your movement and not slouch all the time. So it makes sense why those muscles get annoyed. So if you strain your muscle, a lot of times it wouldn't have strained had it not already been overstretched or had lost elasticity. So what can you do about it? Well, the good news is there's some really simple things you can do about it. So remember when I said back pain can be treated naturally. So you can fix it with posture, you can fix it with the right type of movement, you can fix it with the right type of exercise, okay? And now remember, some of you on here, if you just take some of these tips, you are gonna be amazed at how great you feel even within a week. But for some of you, and I'll get into this a little bit, if you try some of these tips and things don't go the way you thought they were gonna go, that means your problem just might be a little more advanced. And that's a reason to get expert help and get someone to help you with it so that you don't have to try it on your own. So you'll know, I mean, everything I'm going to tell you tonight is normal, and you should be able to do it successfully. But if you can't, that's a reason to get help. Or if you just don't even want to kind of try doing it on your own, it's a reason to get help. So the first thing I tell everybody is to interrupt their sitting. So as you heard me say, we sit and we bend 3,000 to 5,000 times a day. We sit way too much, and over time it aggravates your spine. Sitting itself is not bad. The problem is the frequency at which we do it. So interrupting your sitting is one of the first things I say to all my clients. Just get up off your butt every 30 minutes or so. Don't sit for prolonged periods. Now you're probably thinking, well, what, I have to go on a plane, or I have to do this, I have to go on a long car ride. That's fine. You're not gonna cause all this damage by sitting too long. You start to cause damage that you start to cause the imbalances in the discs and that creep phenomenon in the muscles that we talked about when you sit too long all the time over the course of a lifetime. That's the problem. So you can start, a lot of you here in your 50s, 60s, 70s by now, you can still start to reverse this, believe it or not. So just interrupt your sitting. That's advice number one. So you guys can do that right now. In fact, you're all sitting on Zoom. We've been here about 30 minutes. Time to stand up. Make your posture easier, okay? Sitting doesn't have to be complicated. A lot of people come in thinking, oh, I can't sit up straight, I need to strengthen my core. That's not really true. Remember, first of all, I don't want you sitting very much. You shouldn't sit for more than 30 minutes anyway. But if you do need to sit, make it easy. We have these lumbar rolls right here in our office. I don't know if I have one nearby. We have lumbar rolls right here in our office that we give to a lot of our back pain clients, because you can see right here, it really helps to maintain those natural curves that Dr. Dakota was showing you earlier. If you do have to sit, make sitting successful. So try to mimic those curves that you have when you're standing as much as possible. If you don't have a lumbar roll like this, you can use a towel roll or roll up a sweatshirt. But this is another thing that I always tell my back pain clients that can really help, that you can start doing now. Extend instead of bend. The moral of this story is we bend forward way too much. So you want to have that mobility in the other direction. People don't bend like this enough, and they don't even realize their spine is getting stiff over time. The analogy I like to use, if you take your elbow, for example, it's supposed to bend all the way and it's supposed to straighten all the way. You'll notice, because you use your arms and you go through that range of motion every day, you'll notice pretty quickly when suddenly your elbow can't straighten all the way, for example. And when it can't straighten all the way, you'll sort of naturally on your own be like, hey, what's going on there? You'll notice it right away, and you'll just naturally start to straighten it. What happens is, since we don't go into these movements as much with our spines, we don't notice it's getting stiffer until sometimes it's too late. I see a lot of people, a lot of clients are told not to do this. It's bad for their backs. In fact, back in the olden days, this was never done until they started to realize, wait a minute, this is a joint, just like your elbow. It needs to move in all directions. So a big thing in our office is mobility before stability. You want to make sure that your joint, which is your spine, is made up of a bunch of joints. You want to make sure it's moving as well and as well as it can. It may not move like it did when you were 20, but we want to explore and optimize that mobility. And this is where a lot of people get into trouble. So if some of you on here tonight, it really, really hurts when you bend, you might think to yourself, oh, I shouldn't do that. No, you actually should be able to do it in theory, but you just might need a little help to get there. So that's a sign sometimes that maybe you need a little bit of help. But if you're not bending in this direction, start now, because your spine needs it. And then the last thing we like to do is strengthen. We work a lot on the core, because when you strengthen your core, it does help to support your back, especially all those muscles that Dr. Dakota was talking about. But you have to do your mobility first. That's why I had that slide first, because mobility has to come before stability. We don't want to strengthen your spine in a range of motion that isn't great. So when we say core around here, we're not just thinking abs or six packs. We're thinking abs, we're thinking glutes, we're thinking hips, and we're thinking back. We like to strengthen your whole body, but that's kind of all encompassing of the core. And what that does, where strengthening really comes in, a lot of people come in and they say, oh, my back hurts, I need exercises to help my back. Well, strengthening helps you maintain where you're at and start to get healthier. That's really where strength comes in. If you have a lot of back pain, a lot of things have to be explored and kind of cleaned up, if you will, first before you go into strengthening. A lot of times, that's what I see a lot as well. People want to get the best exercise, or they do these core strengthening programs, which, by the way, we offer here as well. But if they haven't done a couple of the steps we just talked about first, like specifically exploring mobility, you can actually make yourself worse by strengthening too soon. For example, back to that disc example I was telling you about, if you've got a real painful bulging disc that's hitting a nerve and shooting pain down your leg, and you try to start doing these flexion movements that are a lot of times in a core strengthening program, you're going to aggravate that disc even more. So you need to clear that up first, restore your mobility, which will actually help your disc, and then you can start strengthening. But you don't need surgery to do it. Surgery can actually cause more problems, because you'll never know the real movement pattern that was there underlying. So as I mentioned, you can see a specialist as well. Especially if you try these tips and they don't really work the way you thought, or you try bending backwards, for example, and you start to feel worse, that's definitely a sign you should see a specialist who can help you. Definitely someone who specializes in movement or mechanical back pain, because if you go to that MRI first, you can end up down a rabbit hole of tests and procedures. So you want to make sure you get the correct diagnosis. 70 to 80% of the time, it's going to be mechanical. If you go to someone who understands this kind of thing, they're going to be able to tell you if it is. You want to restore and optimize mobility first. Then we go to strengthening and stabilization. And then you kind of keep it all together by just building better postural habits, better movement habits can really help to prevent back pain over the long haul. So takeaways, okay? Back pain is common. It's very common, very normal. So if you have it, don't feel like you're kind of an outlier. Back pain impacts 80% of the population. That's why we specialize in it, because there's so many people that have it. There's so many people out there to help. Back pain's expensive, but it doesn't have to be. There's natural, I mean, it doesn't cost anything to get up from your chair every 30 minutes, right? It doesn't have to be as expensive as it is in this country. And it's often misdiagnosed, meaning, yeah, your disc might be bulging and that might be the thing pinching on the nerve, but the way the disc got there, why the disc is being aggravated is the thing that is often missed and not explored enough. And an MRI or an X-ray won't tell you. So when you go that route and you only go that route, it leads to a lot of unnecessary procedures and surgeries. And we see that all the time. And if you did have a surgery that didn't go like you wanted it to, the good news is you're not doomed. You can still get better. Might take a little longer. That's why we try to avoid it to begin with, but you can still get better. We have a lot of success stories here of people that had surgery, multiple surgeries. We just saw a woman today actually who's had 2 back pain surgeries. And the reason she's here is because she does not want a third. She does not want a third surgery. She wants to really make sure she explores everything. It might take her a little while because she has had the surgeries, but she can still get there. We have numerous stories like that. So don't feel like you made a mistake or you're done if you did that. Final take home point, 70 to 80% of all back pain is mechanical. So the majority of it is mechanical and it cannot be diagnosed with an MRI or X-ray. So if you do want some help, if you're thinking, okay, I need to go talk to one of these guys or a specialist, we have, you can come in for free and talk to either Dr. Dakota, we have another specialist here, Dr. Jess. What we do is we don't believe in wasting anyone's time or money unless we know we can help. So you can come in, talk to one of my specialists. We will figure out, number one, can we even help you? Number two, are you a good fit for what we do? Like, are you in that 70 to 80% that might have mechanical back pain? And then it's a chance for you to see if we're a good fit for you. It has to match up, right? So we don't have many of these available normally. We usually only have about 2 a week that we reserve for people that are just kind of calling us. But I knew a lot of you were going to be joining. I had 56 people sign up for this tonight. There's a lot of you on here live right now. Dr. Dakota and Dr. Jess kindly cleared their schedules a little bit and put extra spots just this week and next week for you guys. So I know Sam is on and Dr. Dakota is on. You guys can even message them right now. And if you want to get one of these, let them know and they can make sure they write your name down. They can get in touch with you. Sam might even be able to schedule you right now, but they will fill up. They always do. So if you're thinking, okay, I want help and I want to talk to one of my specialists, definitely take us up on this. And we'd love to talk to you and see if we can help you. And that, my friends, is all I've got. So now I'm going to open up the floor for questions. Let's see here. Okay. So who's got questions? Let's see what we got in the chat. So what if it's not mechanical, someone asked. So if it's not mechanical, then that might be a reason to get a procedure or surgery. So for example, stenosis is a tricky one, right? So some people, stenosis is misdiagnosed a lot. There's really certain diagnostic criteria to determine if you've got true stenosis, that's your problem. And that may or may not be a reason to get surgery. But another reason to get surgery would be if you have what we call progressive neurological deficit. So that means your nerve is pinched so badly that your leg, the muscles, the nerves are just like deteriorating so quickly. You might have bowel and bladder problems. These are signs that are picked up pretty quickly. That would not really be mechanical. You need to go in and get surgery for that. The other thing that is not mechanical would be like if you fracture your spine or you have some kind of trauma to it. That's not mechanical. That's just, it has to heal. You may need a procedure for that. But 70 to 80% of the time, it's mechanical and you don't need to get a procedure to do that. So hopefully that answers your question. That's a great question. We get that one a lot.
I've gone to a chiropractor for many years, and the chiropractor generally keeps my back okay by doing adjustments. So that's mechanical, I think. What do they do that's different from what you do?
So that's an excellent question. So you actually were very intuitive to say that the fact that the chiropractic adjustments help you, that does mean it's mechanical.
Right.
What the next piece is learning the habits that maybe lead you to needing those adjustments. And then you want to work on strengthening and stability to ultimately not need so many adjustments, right? So for example, the big difference is the chiropractor is doing them for you. What we do here is we teach you how to do it yourself. That's the big difference. So it's not that it's one is better or the other, it's a personal preference. Do you want to have to go somewhere and do things all the time? And there's definitely a time and a place. We work with so many amazing chiropractors in the area. And I have to say, when you've got really terrible acute pain, they're really great at getting rid of it really quickly. But you don't want to have to rely on it or go all the time. You really want to develop tools so that when you're in pain, you can help yourself. And then the other thing is, people usually come to us in pain. So we get them down to a point where they don't have pain anymore. And you know this from personal experience, but we get people down to a point where they don't have pain anymore. And then what we do is we teach them how to detect if their back is going to start giving them trouble. So for example, I mentioned the elbow, right? Because you move your elbow all the time, I know immediately when my elbow is starting to stiffen up because I move it all the time. When you can start to tell on your own, when you can literally measure your own back and know when it's stiffening up, you can prevent lifelong back pain. So that's the main difference. Hopefully that answers your question.
Thank you.
You're welcome. Great question. Who else has a question?
I think it was a great presentation. Thank you.
Oh, you're welcome. Who was that? I missed it. Oh, thanks, Anne.
It's working. It's working. If anybody has any doubt, please go in and talk to them. It does work.
Oh,
And
thanks,
I've been
Jan.
to a lot of physical therapists. So,
Jan, what did you learn tonight?
I learned that I am going to have to constantly do exercises and constantly move. Okay, and they're not difficult exercises at all. So I just, I learned a lot about my spine.
That's good.
That was good.
Excellent. Thank you. I'm glad you joined us.
I am also. Thank you.
You're welcome. Who else has questions or comments, takeaways? Let's see. Someone's asking me in the chat. I can't sit in a car long enough to get from home to Portsmouth. It's good to know we're here. And I can manage my pain better. I'd like to drop in. So yeah, Mike, we'd love to see you. Believe it or not, we've had people drive to see us from 3 to 4 hours away. The beautiful thing about teaching you how to manage back pain on your own is that we can really accomplish a lot in just a few visits. We will often see people over the course of a long time, but maybe not so many visits, especially people that live far away, because we understand there's a distance thing there, but we can still help. And what's great about the way we work with back pain, since we're trying to teach you to do it on your own, if you are in New Hampshire, we can do telehealth with you and do Zoom and help you that way as well. So there's always, I'm a big believer, if there's a way, we'll find it. So there's always options.
Well, thanks, Carrie. My problem is if I sit in the car for more than like 15 minutes, the pain just gets unmanageable and it burns right through the meds. So I can't really go very far out of town to do much of anything anymore. But when and if I can get pain managed better, it's good to know you guys are there. I learned that, the first thing my doctor showed me was my MRI, and he points to the stenosis and he says, aha, that's where your problem is. So I say to myself, yep, that's science and that's for sure. And then I start looking on the net and I find, lumbar laminectomy syndrome, 40 to 50% failure rate. And then I begin to notice that there's lots of different ways of interpreting MRIs. And as you said, some guys go through, and a doctor told me this, some guys go through life with stenosis worse than mine and have no pain at all. So this is why I have pain and he does not, is a mystery not explainable by what I see on an MRI.
Yeah, 100%, 100. And that's what the kind of the basis of this is all about. Just real quick for you, I mean, try something like that lumbar roll or make your own in the car. That could help ease off a little bit. And maybe that will help get you a little bit further at least. And then, if you can, we'd love to help you because, we can get you past that point.
That's very nice of you, Carrie. It's just good to know you guys are there.
Oh, thanks, Mike.
Okay, let's see. What about sleeping and mattresses and firmness and all of that? What do you, just speak in general about that?
No, great question. So mattresses generally, so here's the thing. If you go to sleep and you wake up feeling rested and you're not in pain, you probably have a good mattress. And a good mattress is going to be different for everyone. So for me personally, and I would say the majority is kind of a firmer surface is usually going to be a little bit better. But some people, that doesn't help them at all. So if you are generally pain-free, okay, and your back doesn't bother you too much, and you go to bed, and every time you wake up, and that's the only time you're achy, that there's a good chance that it could just be your mattress. A lot of times that isn't the way it works. The mattress just aggravates things even more. But if you've got a sensitive back, and you've got a back problem, or you've got pain going down into your thigh, and you've got a soft, saggy mattress, that's not good, because then you're going to naturally kind of slouch and flex into that mattress. And if that's the reason that's causing more aggravation to your nerve, you're not going to sleep well, and you're not going to wake up feeling better. So it's a personal thing, but generally I do think kind of that medium to firm, generally speaking, is people have more success with that. Soft, saggy is usually going to make you pretty sore and achy. Does that answer your question?
Yeah, I just wanted to hear you address the topic. Yeah, thanks.
Yeah, you're welcome. All right, we got time for more questions. Anyone have any other questions or takeaways? Okay, so I think we're gonna wrap up if everybody feels good. Who enjoyed it? Let's see a show of hands. All right, awesome. So remember, if you are having trouble and you want to get some help, reach out to us. We'll talk to you and we'll let you know what some options are. Al, did you want to share something? I can't hear you, Al. You got to unmute yourself.
Comment, I've been working with you fellows for quite a while, and I think the thing is so unique about what you do is it's all tailored to the individual. And I think anyone has that there's no one size fits all at all in your operation. It's all very much, and I've discovered that not only is it tailored to me, but as I change, you change. And I think that's a very important part of what you do.
Thanks, Al. Thank you. Appreciate it. Well, if you want to be like Al and Jan and become part of our family, just reach out. You guys will get this replay if you want to listen to it again or share with any of your friends. And we're here for you anytime. If you're looking for help, take us up on that offer. There's no obligation to work with us, but you'll get all the information you need to ultimately make the best decision for yourself and decide if the kind of help that we have to offer is what's right for you. So thank you all so much for joining us tonight. This was fabulous. And hopefully I'll see all you guys soon. Bye.